And this month, Lung Cancer Awareness Month. It is the second most common cancer in men and women in the United States, also the leading cause of cancer death. Joining us now to talk more about lung cancer and how to screen for it is Assistant Professor of Thoracic Surgery at Rush, Dr. Jillian Alex. Good morning to you, Dr. Alex. Thank you for joining us.
Absolutely.
Now let's talk about why lung cancer, one of the most common cancers, is so rarely screened for.
It's one of our newer screenings to start. So mammography and colonoscopies, most people are very familiar with, been around for years. Lung cancer screening sort of only came on the map in about 2013. So we have a 10-year history. So we've had a little bit of problem getting the word out about it.
Yeah.
And our screening criteria, it's not quite as easy to get there as say mammography or colonoscopy, which is based off of an age requirement. We ask for a little bit more for that.
One of our colleagues, our former weathercaster here on the Weekend Morning News, Mike Hammernick, passed away a few years ago from lung cancer, never a smoker, and kind of ignored the warning signs of this because he didn't have a lot of risk factors. Talk about that when you haven't been a smoker but still get lung cancer.
Yeah, so we're seeing an increase in that, some of our non-smokers. We still are working on figuring out exactly what's causing that. We're getting better and closer to that. And I think when we think of risk factors for lung cancer, we've traditionally focused on smoking, which is what our screenings do. That's what we have to get screening, is a history of smoking. But hopefully, coming the next few years, we're looking at other family risk factors, genetic factors that are playing in. So hopefully we'll see, an expansion of lung cancer screening criteria to some of our more at risk, but not just because of smoking patients.
In environmental factors, I can imagine as well. Talk about those things that people should be aware of if they're living around it or happen to be living in a home that has certain qualifications.
Yeah, so high radon we know is increased to increased risk of lung cancer. We see that in some of our more downstate patient population. We don't yet at this time have a cutoff or a stringent, if you have this much radon exposure in your house, you're gonna be at increased risk. We know farms, industry, those kinds of things certainly relate to lung cancer. Again, we haven't gotten quite there yet. We're hoping to increase our funding for research to figure out which of those patients with those known exposures we need to be screening.
So we're talking about risk factors. Talk about those early warning signs that people should be paying attention to go to their doctor and say, I think something might be up.
So what's so scary about lung cancer is there really aren't many early warning signs. Often we don't detect it until patients have a cough, that pneumonia that just won't go away, that you've been on antibiotics for 3 years. Push your doctor on that. Make sure we're getting, more imaging, seeing someone else. And that's why lung cancer screening is so important, is because we can catch these early asymptomatic cancers.
Can it be as simple as having a chest x-ray?
It's a chest CT scan.
All right.
It's a 30-second test. You don't need an IV for it. You go in, you do it every year, and it's no tube. People worry it's the tube test. It's not. So claustrophobia is usually not an issue. And Medicare, private insurance, and Medicaid all pay for it without copays in Illinois. So it is affordable.
Dr. Jillian Alex, thank you so much.
Absolutely.
Do appreciate it. Your first time on TV, you did a wonderful job.
Thank you.
For more information on how to protect yourself or to schedule a test, you can check out the screen. Again, Jillian, thank you very much. Do appreciate it.
All right, thank you.
From Dr. Jillian to Dr. Tim.